Intra-arterial stenting for vascular control during sphenoid with meningioma resection. Invasive meningiomas are difficult to resect as they tend to cause neuropathies, visual disturbances, and encasement of the main arteries. There is no accurate test which can predict vascular invasion. Cerebral vasospasm after tumor removal was described by Krajanbull in 1960. Severe stenosis of the carotid artery is assumed to be predictive of a poor outcome, causing a stroke or direct vascular injury. A 59-year-old woman with a history of 5-month headache and seizures and 1 month of right hemiparesis and language impairment. CT scan demonstrates a left hip intense mass causing midline shift. A contrast MRI confirms a left sphenoid with meningioma with MC8 encasement. Due to the location, implantation, and relationship with vessels and eloquent areas, this lesion was considered highly complex. Possible surgical complications were deeply analyzed, and the team studied the benefit of pre-surgical stenting of the left MC8, considering vasospasm risk during or after surgery. Left pterional approach was used, and the left MC8 with intraluminal stent was visualized during procedure, and it helped a better vascular control, preventing from direct vessel damage and allowing a more radical resection. After surgery, the patient showed a better motor function, and the post-operatory CT scan demonstrated a complete tumor removal and no signs of vasospasm. A 29-year-old woman with a history of subtotal tumor resection 4 years back. She presented with a worsening headache, impaired visual field, and right sinus weakness. A contrast MRI revealed a large left meningioma, edema, and midline shift. Brain angiography plus MC8 stenting in the M1 segment and partially in the M2 segment was performed with no complication. The left pterional craniotomy was used, and the intra-arterial stent was easy to identify during the procedure, and it was used as a landmark for a more radical resection. After surgery, the patient showed mild motor function improvement and no signs or symptoms of new-onset ischemia or bleeding. Prognosis depends on the extent of tumor resection, arachnoid plane between the mass and the surrounding neurovascular structures, and preoperative neurological condition. The mortality due to ischemia, edema, and residual tumor bleeding has ranged up from 8 to 27%. Giant sphenoid wing meningiomas encasing major arteries increase the susceptibility to vascular injury and severe ischemic complications. The incapacity to identify arterial invasion on any preoperative imaging remains a problem. Initial imaging often includes a CT scan, but MRI allows soft tissue differentiation. This will not reveal if vascular invasion has occurred, but will identify the location, deviation, or entrapment of major vessels and nerves, as well as the tumor extension and edema. Angiography is not generally suggested unless embolization is planned, but it can give a better idea of neurovascular involvement in order to manage it. Several techniques to treat atherosclerotic stenosis of the intracranial IC8, such as angioplasty, stenting, and extra intracranial arterial bypass, have been proposed. But there are very few reports concerning vascular stenosis related to the tumor compression. The risk of neointimal hyperplasia and the need for lifelong antiplatelet drugs is always a concern. Current methods for vascular information intraoperatively include static and dynamic images combined with augmented reality, Doppler ultrasound, high-quality microscopes, or injectable fluorescent dyes. Yet, each of these systems have inherent limitations. Vasospasm can cause severe neurological disability, and it makes surgery a real challenge. Thus, these reported cases raised important questions regarding the possible interventions to avoid vessel damage and vasospasm during or after surgery. The authors recognized the possibility of such an occurrence and the importance of finding effective treatments for a preventable event. Subtotal safe resection should be considered when significant vascular encasement is found. However, we proposed that the intra-arterial stenting could effectively benefit a safer and more radical tumor resection. Thank you.